Dr. Heidi Overton is the director of the Center for A Healthy America at the America First Policy Institute. She worked at the White House and she's completing medical training in preventive medicine, as well as a PhD in clinical investigation. I've known Heidi for several years. She's one of the people I know who is most committed to helping patients to make sure they have the information that they need to receive the best possible care and also to help educate doctors. Heidi's chapter is titled Implement Transparency, Release Data to Improve Decision Making. Heidi, why'd you write your chapter?
Thank you so much, Brian. I wrote this chapter so that we could really help empower patients. The main point of this chapter is to encourage states to release their Medicaid claims data and implement things like physician practice pattern metrics that allow us to see patterns of care over time, that when patients are able to see this information, they can make the best decision possible for them to choose the best doctor and the best care that they need. So states can play a pivotal role by just releasing data and improving transparency. And this will really improve the quality of care that's delivered.
Okay, Heidi, help me understand this with an example in your book. So you talk about appropriateness measures and physician practice patterns, and you give a concrete example of C-sections. And C-sections are really important in the Medicaid program because Medicaid pays for about 40%, actually more than 40% of labor and deliveries. So tell us why you used this as an example in your chapter.
Yeah, Brian, the medical community has reached a consensus that we do too many C-sections, often inappropriately, and that we're providing unnecessary care for women across the country. And some areas have higher C-section rates than others. And this has real ramifications for women. They can have more complications after that birth, and also they can be more likely to have another C-section at their next pregnancy. We found something called low risk births in the country. 25% of those are delivered by C-section, and the medical community agrees by consensus that's too high. One of the ways that states and Medicaid programs can start to reduce this number would be to show the provider practice patterns that are delivering too many births by C-section, and to empower patients with this information so that before they choose their OBGYN or go in to have their baby, they know how many C-sections they perform. And we know that there's variety in medicine, but we also know that there's usually a threshold by which exceeding that is inappropriate care. So we want to reduce inappropriate care and improve quality for women and empower patients.
Hey, so Heidi, this seems like a no-brainer recommendation to me, like it's transparency. So release this information so that patients have the best information available. And the C-sections are really important. I mean, as we know, maternal mortality is a growing concern in this country. Some doctors may be concerned that this is government coming in and imposing standards on them. Can you sort of explain why that shouldn't be a concern for doctors?
Yeah, this should really be thought of as quality transparency. When data is released, it'll be released with clinician consensus for what certain metrics would be. So the government won't be saying, what doctors should and shouldn't do. Appropriateness metrics work best when there's clinical consensus. Doctors should think about this as a way to get more information on how to improve their practice and improve the care that they're delivering for patients.
Heidi Overton, thanks so much for your work on this important chapter.